Thank you. So, good afternoon, everyone. For those of you that were not on last time, I'm just going to kind of go quick. I'm Shelly Solzberger. I'm from Kansas City. I'm a nurse by background as well as a certified professional coder and an ICD-10 trainer. And I work with health centers all over the country, helping them with coding documentation processes. So we're just going to dive right in and get started. So we're going to, so sorry. We're going to talk about, again, front desk. If you were on last time, we're going to kind of recap a couple of slides. We're really going to talk about the importance of greeting patients, really understanding registration and scheduling, insurance, different terms to know, collections, and again, how important you guys are and understanding your role and how important it is that you are part of that team-based care. So if you have a question, please feel free to put it in the chat box, and Devin will just kind of stop me periodically. And then we'll also have time at the end. So I just kind of want to recap. I'm not going to go through all of these slides again, but there's two slides I definitely want to recap on. You guys have a lot of responsibilities. So you're really important. You have to remember that. So you do a lot of different things in your duties and jobs. So you have to also remember you are the very first impression and typically the last face to face, right? So you're the first person I see when I come into the clinic, and then you're the last person I see. So just remembering how you deal with your patients, how you handle situations, all are so key and integral to the health center. So I want to start off with a polling question. And it's just a true or false. Billing starts in billing. However, front desk is the secondary critical component. So just answer true or false. I'll give you a couple seconds and then we'll talk about the results and then kind of move on. Just waiting on a few more people just to finish their survey. Perfect. So it looks like 90% said false and 20% said true. So we'll talk about this a little bit. So if you were on last time and you may not have, or there was a lot of information as well, right? So billing doesn't start in billing. Billing starts with that very first phone call. So typically it's going to be the call center or the front desk. So you guys are really the kind of what I would say is our key person for starting billing. Billing in the billing department is typically much later because we go through all of the key components on the front end, right? So getting that information from that patient on their insurance, registering them, etc. So billing starts typically on the front end. Okay. All right. So let's talk about greeting. Greeting happens a couple of different ways. Answering the phone, right? So again, maintaining that polite, consistent manner. So we talked a little bit about last time is always asking the patient, can you put them on hold? For example, when many of us call different organizations, we call and typically we get this. And I apologize for talking fast, but this is how we get it. Good afternoon. Thank you for calling ABC Health Center. Can you hold, please? And we just shove somebody on hold. First of all, they're trying to even register and digest where they just called. And did that person even tell me who they were? So really thinking about that first phone call and slow down a little bit. I talk fast, so I'm really one preaching to the choir because I preach to myself about this is slow down. Thank you for calling ABC Health Center. This is Shelly. May I place you on a brief hold, please? Also, when your patients walk in, right? So really, if you think about greeting patients outside of the phone calls, when their patients are coming in, their greeting starts long before they ever walk in your door. But we don't always think about that. So looking for a place to park. I can't find a spot. Looking for that main front door, where to go in. That's all about part of our greeting. A lot of us have never really stopped to think about that patient's whole experience. park where they park, walk where they walk, sit where they sit. It gives you a different perspective. So if you think of this, now this is all out of your control, right? You can't say, you're not going to say, well, gosh, I'm going to change where the front door is, or I'm going to change the parking. But what you can do is, I'm frustrated. I was already running late. My kids were driving me crazy. I couldn't find a parking spot. I went in one door, it was the wrong door. I had to go to the other side. So I'm really frustrated as a patient. But your welcoming and personal greeting can make or break. It can have a huge impact on my mood. When I walk in and I'm all frustrated and kind of angry, just talking to me in a nice way, welcoming me, using my name, all of those things are key. Within 3 seconds of arrival, you should already be acknowledging your patient. Good morning, Shelley. How are you today? Eye contact, smiling. And I do know it's hard to smile under your mask because we're living in that different world. So even just train yourself that you want to smile because my cheekbones go up. So these combination things, the greeting, the smile, eye contact, all are going to start pushing our patients and ensuring that they feel welcome. So if you think about smiling, sometimes we get so busy, even prior to COVID when we didn't have a mask, we forget to smile. And it's not that we're trying to be rude or we don't think about it. Sometimes we try to force our smile. Hi, I'm Shelley. Hi, how are you? So again, it's not genuine. So really start thinking every day when you walk in, just kind of breathe in, get ready for your day. Remember that patient, you might be the only person that uses their name, that thanks them for coming, that smiles at them. Good eye contact. Don't be looking down like this when you're trying to talk to a patient because they don't even know what you're saying, but you also don't want to just stare like this because that's intimidating. So using your eye contact, your head kind of moving around. Good morning. Welcome. Those are key things. Patients also want to be called by their name. So if you think about it, going to the doctor is one of the most personal and private experiences we all have. It's, intimidating. It's scary, even when you're going in for a well check because you don't know what might happen, what they might find. So we've even seen results where patients have better satisfaction if we're using their name. I don't really want to be called ma'am. I feel old. Yes, ma'am. I'm like, oh, no, don't call me ma'am. I don't want to be called Mrs. Sulzberger. I want to be called Shelley. So using a patient's first name, recognizing them, greeting, all is part of that experience. You start that flow by notifying the MAs that the patient is there. So again, whether it's through the computer, whether it's contacting them, however you notify them. What's really nice is we're trying to build that team between you and the clinical staff. So if you see that it is 12:09 and Mrs. Smith just walked in, you're going to contact the MA to tell her that Sally Smith just walked in the door. Her appointment was at noon. You're going to get her going as fast as you can. That way we're communicating across the board. We also need to be mindful and remember to respond to patients or prospective patients and visitors in a courteous manner. Sometimes we get frustrated and it's like, it's not even your day for your appointment. What are you doing in here asking questions? So we just have to remember to take a step back and really to be courteous to every patient or visitor. And when you're thinking about greeting patients, it's not just about the words that come out of your mouth. It's how you interact. My words can be really friendly, but I can be rolling my eyes and sitting like this and kind of having this fake smile. So we have to, at the front desk, make patients feel welcome. We have to make sure that the first impression is the best, right? Because you're representing that health center. So we want it to be exceptional across the board. As I told you last time, our patients make a first impression within 30 seconds. Patients can't measure if they get good quality, right? When you go to the doctor, you don't say, well, gosh, this provider has great quality. We don't know if he has great quality. We assume they do, right? That's why we're going to them. You would never go to a provider that you didn't think provided good quality. So Patients learn to measure quality by their experience from the customer service aspect, right? So if you think about it, if I walk in and you're not so friendly at the front desk and the MA is not so friendly and nobody's really using my name, I am going to say that you don't have good quality care there. My experience was terrible. These people have no idea what they're doing. It doesn't mean that you don't have any idea what you're doing. You may have a really good idea, but you're just not really friendly at doing it. So again, thinking about that patient's experience. And remember, perception is reality in someone else's eyes. So we talked about last time, good eye contact, lean in and listen, use the patient name. Then we move to scheduling. Now, some of you are responsible for the schedules, some of you are not. It depends where it falls in your organization. But managing the schedule is just as important as greeting your patients, right? Because it needs to be effective and efficient. So, do you have stuff close by? So, if I'm leaving, checking out, and you're making my follow up appointment, do you have everything you need? Are you trained on how to make a follow up appointment or an initial appointment? So, when we think about scheduling, of course, as you know, it's one of the most important aspects. If you don't get patients on the schedule, you don't get any revenue, right? Because you don't have anything to bill. So scheduling is really key. So, we never really take a step back and really think about the whole process. So if a provider wants to see a patient at 8 o'clock and the patient is scheduled at 8 o'clock, is that going to work? No. So if the provider wants to see the patient at 8 o'clock, we need to have that patient come 10 to 15 minutes early. So we have to evaluate how much time does it take for the patient to check in, get registered, complete any forms, have the MA walk them back. So if it takes 20 minutes, then I need to have that patient there at 7:40. So really thinking about your patient schedule. I do know, just for people that are on the phone, some of you will say, gosh, when we do our automatic calls, it won't let us tell the patient to come at 7:40 instead of 8 o'clock. So what some groups I've done when I've done some process improvement is we have set up what I would call like a nurse schedule. And so that way when we set it up, let's say I'm supposed to be there at 7:40, but my appointment's at 8. We would set it up on the nurse schedule at 7:40 and on Dr. Jones at 8 o'clock. And so when the call comes in, we link the call to the nurse schedule. Shelly, I've got you scheduled with Dr. Jones at 8 or 7:40 on Monday, December 12th. It doesn't tell me to come at 8. So my appointment starts at 7:40. We don't tell the patient that your appointment's going to be with Dr. Jones at 7:40. Your appointment starts at 7:40. They're used to going through the process anyway. So really thinking about how to manage that a little bit better. Also thinking about how we schedule patients. Don't schedule a new patient the first patient of the day. Why not? They typically have a higher rate of no-shows. They have a higher rate of being late. They have more paperwork. So really thinking about the best way to schedule people. We don't want to schedule a lot of well woman exams back to back. So, or preventative, really try to think about those schedules. Think about schedule delays. So notifying patients immediately if a provider is running behind. So if you already know that I have a 12:30 appointment and here it is, well, let's say it's a 1:30 appointment and here it is at noon, call that patient and let him know that he's running a little bit late. They can come in about 15 or 20 minutes late. Offer to reschedule if they're already there. Different things that you can do, but always keeping in contact with the patient. Late arrivals. Now, this isn't always a black and white issue. This has to be about your policy. But we don't want to say to a patient when they come in, well, Devin, you're late again, right? What kind of customer service is that? So we have to figure out, how do I tell Devin that it's not okay to come in late all the time? We can't keep doing this. So when Devin walks in, and this takes practice and role playing, is I want to say, well, Devin, it looks like your appointment was at noon. It's 12:15. I know things happen. I wish, in the future, if you just call and let us know you're running behind, I'm going to check with Dr. Jones. He may have you wait. You may have to reschedule. I'm not really sure. But go ahead and have a seat. Let me talk to him. And maybe we make the patient wait for a little bit before they're taken back. And then for that MA to kind of reiterate what the front desk just said. As I'm taking Devin back, hi, Devin, I'm Shelly. I work with Dr. Jones. I'm putting Devin in the room. And I'm going to say, you may have to wait a little bit. I'm so sorry. Your appointment was at 12 and you were about 15 minutes late. And I understand things happen. If in the future you can just let us know, then we can kind of be prepared. We didn't know if you were even coming. So, but just hang out here. I'll check back with you and kind of keep you posted. I want Devin to know that we know he's late. What happens is we don't know how to say that in the right way, so we avoid it. So Devin's like, well, they don't even know I'm late. So it doesn't really matter because I'm going to have to wait for the doctor anyway. So we never really talk to the patient about that. And if it becomes a consistent habit, then sometimes the providers have to step in and say, hey, this isn't going to work. We have a schedule. You need to be on time. Same with dealing with no-shows. So what does our policy say, number one? Number two, let's think about tracking no-shows. If we see that no-shows are common on a specific day, kind of across the board, is it a transportation issue? Maybe the buses don't run that day or they only run at a certain time. So those are things we want to think about. Also, when you're scheduling patients, if you see that this patient doesn't come in on Fridays and they keep making appointments on Fridays, let's not schedule them on Fridays. And if they request a Friday, it's okay to say, hey, Shelly, it looks like the last few times we scheduled your appointment, they were on Fridays and that date didn't seem to work for you. Why don't we look at another option? I'm not saying, well, you didn't show up, so we don't want to keep scheduling you. It looks like it didn't work for you. Why don't we look at some other dates? So again, if it becomes a consistent habit, have them meet with somebody. Maybe there is some kind of social determinants of health or barrier that's not allowing them to get in. So having them talk to somebody. Some people are starting to do 3 no-shows and you can't be scheduled. You have to walk in. And explaining to the patient, Shelly, you're already at 2 no-shows. Our policy here at ABC Health Center is once you have 3 no-shows that you no longer can schedule appointments. You have to come in and just be wait in kind of a walk-in setting to be seen. So again, thinking about your patients, notifying them. That's why I believe in a patient advocate on new patients. We talked about that last time, having someone call that patient when they're new, explaining what we expect of them and what they can expect of us. Again, efficient scheduling, of course, is necessary for good patient experiences and a really smooth flowing patient schedule. We have to know when we can double book, move patients up, fill in cancellations. All of that is going to be key. So you guys have to be thinking every day in advance about your schedule. So pre-planning, who's coming in, which providers have openings, which providers can I double book, things like that. As you know, efficiency is key in any aspect of our healthcare. So we need all of the tools close to us. If you have to get up and walk a few steps to copy something, or you've got to go to a different area to scan something, that's not going to be efficient. So making sure you have all of your tools close at hand. Don't skimp on staff training. We know that turnover is high. We know that typically what happens is we get a warm body. We put that new person with the old person before they leave for a few days. Sometimes that person that's walking out the door really doesn't have a vested interest anymore. So they're going to train them on the bare minimum. So we've got to have a really good training program in place. They should be that front desk or call center should be sitting with each other. They should be sitting with billing, really understanding the whole process. We should be going through the intake forms, looking, do they follow the data entry screen? If you're giving your patients forms, 2 things I would think about. One, do you really need to have them do it via paper? Why not sit them across from me and let me type it in and ask as we go? And some of you are going, oh my gosh, we don't have enough time to do that. Well, you're spending the same amount of time trying to take it off a form that I filled out that you may not even be able to read, or that I've left part of it blank. So really thinking about those processes to become more efficient. Yes, it will take a little time on the front end, but you'll learn that process and that habit will become second nature. Also, think about moms and dads who are divorced and don't live together. Is there a way to notate in the chart who has permission to treat the child or get information? So all of those things are key. Financial policies. Do you know your financial policy? If I ask you about it, can you tell me? Typically, what we see patients get is, here's our policy, you need to sign it at the bottom. Those patients don't read it. They don't really know anything about it. So really what I'd like to see is when I check in, you say, Shelley, this is our financial policy. And kind of what it says in a nutshell is that we'll bill your insurance, but you are ultimately responsible for payment, etc. I'm going to go through that policy in a 30-second elevator speech so that patients feel like they have an understanding. Some of them can't read. So they're just signing it thinking, well, hopefully it's okay. I don't really know what it says. Some of them are not literate enough to understand what it says, even if they can read it. So thinking about all that, if it talks about your no-shows and cancellations, we should give them the 30-second elevator speech. We should go through the welcome packet with them. So again, making sure we have all of that is key. Have attention reminders. Again, looking at no-show rates. We should be tracking them, right? Who's not coming in, how often, where are no-shows? Is it a specific provider? Those are things to think about. All right, so I'm going to look at another polling question. Should the front desk team huddle in the morning before the appointments start? Give you just a couple of more minutes, or seconds actually, not minutes. So a little more than half of you have answered so far. So just keep answering the polls. And once we get all of you on the polling process, then we will talk about the results. Give you just another 10 seconds for those of you who have not answered it yet. All right, so it looks like most of you did the poll, but not all. 90% said yes, 10% said no. So definitely you should huddle in the morning. Huddles don't have to take long, 10 minutes. So what are we going to talk about in the huddle? So we've already kind of divided up, kind of done some pre-visit planning, if you will. And then if I have this first group of providers, I'm going to say, hey guys, I've got 2 openings with nurse practitioner Buddy, and I've got 1 opening with Dr. Jones. But Dr. Smith, she never cares if I add people on. And then everybody's going to kind of talk about, oh, you know, Mr. Smith, he owes like $500. So let's make sure we get a hold of billing so they can, you know, we can get them to come up and talk to him about getting on a payment plan. So really kind of just 5 or 10-minute quick huddle to talk about the day. We want to be prepared. Then we move to registration. So registration is crucial, right? Because we have to verify the information of the insurance is accurate. I always recommend, in addition to what we're going to talk about, ask to see the card at every visit, their insurance card. Of course, accurate registration is really what I would call the foundation to commence your revenue cycle. So it's like when you build a house, if you don't have any foundation, your house is going to fall down. So complete and accurate patient demographics. Know your computer screen. Know where all of these things are. A lot of groups are starting in their demographic area. They have an area where they can ask the patient when they get their cell phone number, can we text you? And they click the box that says, yes, we can text you, because patients always have their cell phone tied to them. Again, you're going to verify address. So verifying address does not mean, Shelley, is your address the same? Because what is Shelley going to tell you? It's the same. I don't really have any idea what you have, but I'm sure it's the same. So asking me, Shelley, can you verify your address for us? Of course, because why? If I have incorrect information, could delay in payment. Again, insurance verification. So again, ask for the card at every visit. Verify the insurance. If you're scanning it, front to back, both. You can't just have one side. We need both sides. making sure they're eligible, do eligibility checks. Again, do I have a secondary insurance? Do I have the primary and secondary listed correctly in the EMR or the practice management system? Again, paying close attention to the information on the card, such as the name. So for example, if a patient's name is Robert, but he goes by Bob, we have to have, if his name on his insurance card is Robert, it has to be Robert in your patient demographics when you're putting all of that in. If we put Bob, it will not go through for billing purposes. Collection of copay and outstanding balance. So again, what do I owe? You need to know, right? Because you can't, if you say to a patient, Shelly, are you going to be paying your copay today with cash, check, or credit card? And I go, I don't know, what do I owe? Well, let me look at your insurance card. Looks like $10, but maybe I have a $30 outstanding balance. So this is why pre-visit planning is important. $10 copay plus 30 outstanding balance. Shelly, it looks like with your copay of $10 and your outstanding balance, you have a balance, total balance today of $40. And then sit quietly. So make sure you know, because what happens is, if I ask you what I owe and you only get my copay, next time I come in, if somebody says, well, you have an outstanding balance from a few visits ago of $40, and I say, but I asked her last time and she told me I only owed $10, I'm going to be an unhappy patient. I'm having a bad experience. So again, understanding insurance. So you have to understand Medicare and Medicare Advantage plans. You have to understand Medicaid, commercial, if you are participating or a contracting provider. So with Medicare Advantage plans, these are kind of like what we would call like an all-in-one. They're an alternative to Medicare. Medicare pays that managed care a fixed amount each month. And those Medicare Advantage must follow Medicare rules. Now they can have different out-of-pockets, they can have different rules, pay for more services, but they have to kind of follow the same rules. So again, you have to make sure you know what those things are. You have to understand networks. You have to understand third-party administrator. What that means is if, let's say you have a big, we'll use like the AMC theaters. AMC theaters, they manage their own employees' health insurance. They have like a big commercial company that backs up for catastrophic, but we have to be able, they pay their own claims through that, what I call third-party administrator. You have to know what a health savings and health reimbursement accounts are. So an HRA, which is what we call health reimbursement accounts, are designed to act as a full benefit solution for employers so they can pay some of the medical expenses for the employees. So that always stays with the employer. So if you have an HRA and you have money in that and you leave to go somewhere else, you don't get to take that money with you. Where a health savings account is meant to cover expenses, but what happens is this health savings account goes with you. So if you have money in there and you leave and go somewhere else, you get to take that with you as the employee. Medicare Part B. You have railroad, regular, and durable medical equipment. So who's eligible? 65 and older, disabled, and end-stage renal disease. So when we're thinking about Medicare and if it's primary or secondary, so at our front desk, we should be getting what we call a Medicare secondary payer form completed, also known as an MSP. If you are not doing this and you want more information on this, you can email Devin and I can send it back to him and he can send it out to everybody. So this Medicare secondary payer, it's a form, and when patients come in, when they come in with chronic conditions, you don't have to do it every single time. But when I come in, say today I come in with hip pain, we need to fill out an MSP if I have Medicare. Why? Medicare wants to know if I was injured. And if so, are they responsible or is someone else responsible? So for example, if I fill out on the Medicare secondary payer that I fell down at Hy-Vee, Medicare is not going to want to pay for that because I fell somewhere else. So they want Hy-Vee to cover that. If I were in an auto accident, they're going to want the auto company to cover that. So typically Medicare is secondary to a large group, which is typically 20 or more employees, a federal black lung program, and those questions are on the MSP as well. If I have services that are offered by the VA, of course, workers' comp, and then any of the auto, medical, or no fault. So, again, if I were in a car accident, fell at Walmart, etc. So Medicare secondary payer is something that Medicare does watch for, should be filled out at the front end at the front desk. So let's go over some terms that you should know. So copay. This is typically a fixed amount your beneficiary pays. These are things when you're doing your pre-visit planning, you want to know which patients have a copay. I want to write that down because if they still have that insurance, I want to verify on their card they still have that copay and I want to collect today. Coinsurance. This is a percentage of the medical charge the patient pays. So sometimes your insurance company might say it's an 80-20, we'll cover 80%, you cover 20%. Some of those also say after you've met your deductible. So our deductible is the amount that we must pay as patients each year before our true benefits begin to cover the cost. So especially if you think about your patients that do have insurance that have high deductible plans, for you guys, that's so key at the front desk. You want to make sure you look at that because you can check and see how much I've paid. So for example, I have a high deductible plan. Mine's $5,000. So I would expect if I came into you, you should have already looked and said, Shelly, you haven't met your $5,000 deductible. It looks like you've met 489 or whatever the magic number is. So today we're going to ask for a deposit of $200. And when I say, oh, I have insurance, your response is going to be very simple. Yes, Shelly, you do. It looks like you have Blue Cross Blue Shield. It looks like you have a high deductible plan. Your deductible is $5,000. As of today, only $489 has been met. So we know that you'll be responsible for the entire balance. So today we'll go ahead and collect a $200 deposit. If there is any an additional amount, we'll bill you. If there's a refund, we'll give you a credit or whatever the magic thing is. Usually you're not going to have a refund. So again, we should know this on our pre-visit planning. Balance bill. This is when providers bill the patient for the difference between what they were charged and what their insurance pays. Out of pocket. So the patients, have a certain amount they'll have to pay in a year before it's covered at 100%. Out of network. Sliding scale. So these are all things that you guys should know. Other terms, QDI, quality sorry, that's a tongue twister. Quality Data Initiative. So these are things that you might not be responsible for, but you may hear a patient say, I was contacted to come in for my cervical cancer screening or my breast cancer screening. And you may say, well, we don't have a mammogram or radiology here for mammograms. So again, making sure you know what they are, because we may be calling patients to say, oh, wait a minute, you need to come in because we're not meeting our quality data. Social determinants of health, you might see as SDOH. Typically, these are homeless, veteran status, sometimes it's employment. So there's all different things from our social economics standpoint that can go under social determinants of health. More and more people are including these at the front desk for things like veteran status and housing status. So you need to know about these, because if I come in and you ask me about my housing status, or if I'm a veteran, I may ask you why you're asking that question. So remember last time we talked about you need to know the why. Role play. Internally at one of your team meetings, have someone be the patient and go through all of these things and have that person that's playing the patient ask, why do you need to know where I live? Why do you need my address? How do you know I owe $10? And really start thinking about how you're going to respond. You should always be thinking about what that patient is going to say to you. Again, point of service collections. Verify benefits. Make sure the patient's eligible. Think about how you collect. Do you collect pre or post? Check in, check out. Always collect at check in, right? Because if I owe at checkout, I'm going to sneak out the door. Really be transparent with your patients about their financial obligation. What this means is let me know when I sign up with you as a new patient that I'm responsible for my payment. We need to hold the patient accountable. Again, we do know that we can't turn patients away. However, you are not a free healthcare clinic. So it is important and imperative that you educate your patients on the importance of being on a payment plan and bringing their money. This starts when I make my appointments. Shelly, when you come in next week, this is what you need to bring. And I have my checklist. I need to bring my insurance card. I need to bring my ID. I need to bring my medications. I need to bring my $50. What do I need to bring? I can't pay my $50. Get me on a payment plan. Don't wait until I have $500, right? Immediately, I want to get that patient on a payment plan. I want to talk to them about the sliding scale, help them figure out what they need to bring in, why it's important. Again, have options. Can I pay with a debit card, a credit card? Can we do credit cards on file? Make sure you have all the correct security for that. Cash, check. Even asking patients to say, when I go, I know I owe $50. I told them I'd bring it. I've got 30. I get paid on Friday. Great. Let me give you an envelope. If you just want to drop it by the following week, that would be great. Here's an envelope. Really holding our patients accountable. The problem in an FQHC is we never ask. If I walk into your FQHC tomorrow and you don't ask me for any money, I am sure not going to say, oh, you know what, I'm going to have a balance, so let me go ahead and pay you. I figure if you don't want the money, why would I give it to you? All right, so another polling question. My goal being you guys at the front desk should be to ask 50% of the patients for their copayment if you're not busy. So is your goal to ask 50% of the patients for their copay if you are not busy? So I'll give you a few seconds to fill that out. About half of you have answered, so just a few more seconds. Give you about 10 more seconds. It looks like there's about 3 or 4 of you left to complete the polling. And we don't know who you are answering the polls. I can just see at the top X number out of X number have voted. All right, so we'll go ahead and close it. So it looks like 70% said false and 40% said true. So when you look at this, your goal should be to ask 50% of the patients for their copayment if we're not busy. I'm going to say false, right? I want you to ask 100% of the patients, and you should never be too busy to ask, ever, right? Because how can you keep your doors open if you don't have any money? Can you, as an employee, can you go to another provider's office and get services and not have to pay for them? So your goal is going to be to ask 100% of the patients, and you're never going to be too busy. So for 100 of your percent of your scheduled patients, you're going to check for benefits and eligibility. You're going to make sure they've been informed about the requirements for the sliding fee. You're going to make sure it's up to date. Have they completed it? You're going to make sure that they know about their financial obligation, complete all the forms, and you're going to ask the patient a question, whether it is, do you know the amount you're pay about, do you know your amount to pay today? Or you have a $20 amount that's due, will you be paying cash, check, or credit card? How will you be paying for your services today? You're not going to ask if I want to. I don't want to, right? I want to go buy a new pair of shoes with that money. I do not want to pay your health center. So don't ask me if I want to. You're going to ask me how I'm going to. So let's look at some verbiage. Patient objection, after you ask how they're going to pay, they go, oh, you can just bill me after my insurance pays. You should have a response because you've already role played this. Shelley, we have technology now to verify your benefits and closely determine the amount you're responsible for. So we already know that you're going to have to pay the $50. So we can go ahead and take cash, check, or credit card today and sit quietly. I've never been asked to pay before, or they've never collected money from me before. Why are you doing it today? Shelley, I totally understand. However, our policy has changed and paying at the time of service really helps us control our cost and sit quietly. Dr. Jones told me I didn't have to worry about paying. Ooh, we get that one too. So we should have a response. Shelley, I know. He may have said that. However, I'm not sure that, however, I'm sure that is because he's really focused on your health. But it's our responsibility in the administrative portion to work with you to resolve your account balance. So you do have a $50 balance plus today's visit. So why don't we get you on a payment plan? Or why don't we update your sliding fee, or whatever the case may be. But you're going to hear these objections. So also thinking about I statements versus you. Use a trigger, it's aggressive. You owe $4. I'm like, what? Versus, Shelley, it looks like your insurance, I see you have a $4 copay. How will you be paying that today? You have a high deductible and you haven't met it yet. You will need to pay $200. I see with your insurance plan, you still have a deductible that you haven't met. A $200 deposit will be required. You didn't bring the information for your sliding scale. I'm not finding your application for the sliding scale. We will need to collect a prompt pay discount of $100 today, which will cover your entire visit. So really just role playing. Again, this is why I think it's important to have one of you be your own patient with your team. I think that I don't even have to read this. You guys can read this and really think about it. This bubble says it all. So collections. We have to educate our patients. You are not a free healthcare clinic. You are an affordable clinic. So I, as a patient, need to know my financial obligations. So we have to set expectations. You guys in your job are held accountable. Patients need to be held accountable. Now, it's not to the point where we're saying, well, if you don't bring your money, we're not going to see you. That's not how we handle this. We handle it by telling the patient their financial obligations. Shelley, we are not a free clinic, so we do expect payment at time of service. If you're unable to pay, we do have the sliding fee that I can help you complete the application. I can set you up with financial counselors so they can get you on a payment plan, because we never want to see you get so far in debt that you can't get out. So really think about if it were your loved one, how would you want someone to handle that with them? So again, just talking to them, setting them up with a financial counselor. Again, finding the best mechanism for that patient. Also, patients have a peace of mind knowing that their obligations have been met. There are some patients that even if they have $1 million are not going to want to pay for their services, but most patients feel good about paying for their services. It's their health care. We just have to let them know. We also need to make it easy for them. More and more places, like my dentist, of course, on their text, they send me a thing saying, here's your balance, click here to pay. We should make it as easy as it is to buy on Amazon. Right now, for all of you that use Amazon, which is probably most of you, you click on your phone and in one click, you don't even have time to think about it. You've already paid for it and bought it. So trying to create our payment so it's easy, right? Because in this day and age, even today, if you mail me a bill, I look at it and I'm like, oh yeah, $10. I don't even want to take the time to write a check to give you $10. And then I got to go put a stamp on it and I got to go put it in the mailbox. So make it easy. Send me a text or send me an email so I can click online and just purchase my balance and pay for it. Know your numbers. There's nothing worse than when I say, well, how much do I owe? Well, I don't know. Let me look here. Well, I think it'll probably be, well, I don't know. It might be like around $50. That gives me no confidence. How much is an uninsured person going to pay? You should have all of this at your fingertips. I'm okay if you have to get out your paper and say, Shelley, without insurance and you're not on the sliding scale, let me look really quick. Okay, it looks like you're going to have a $200 and that'll cover your entire visit. It's okay to look it up, but don't be fumbling and not having any idea even where to go. How do you know what to estimate their amount's going to be? And if you're not sure and we're estimating, we're letting that patient know that this is a deposit. We will ask you, Shelley, to pay a $200 deposit. I don't want to think that I've paid in full. So support. Again, support bottom up, top down, sideways. Your organization must live and breathe and act consistency. It's the culture. So if everybody's not on the same train, we won't get there. Every person in your health center, from the clinician to the receptionist, from the CEO, must understand the expectations and the why. Services don't become reduced at the front desk. They need to be enhanced. You guys are the most important people in your health center. Accurate demographics, verifying insurance, collecting copays, all of these things are so key. Having cross-functional team meetings between you and the call center, you and the billing department, the call center and the billing department, all of these things are key. Every penny counts. 50% of overall patient responsibility goes uncollected. 50%. So if you have $1 million of patient responsibility, over 50% of that goes uncollected. 81% of true self-responsibility is never recovered. That's a lot of money. So building relationships, understanding those key areas on your computer and what's expected. Own the waiting room. We want to build a relationship with the patient. If I feel valued as a patient, I'm more apt to want to pay my bill. If I feel like nobody here cares and I'm only coming here because there is nowhere else to go, I'm not as eager to pay my bill. I'm going to put up barriers and I'm going to push. So own the waiting room. Make sure it's clean. Would you want to sit there? Would you want your mother to sit there? Prepare the patient for the visit. Communicating with the patient. You've checked them in, you've collected their money. Shelley, Nurse Betty will be out shortly to get you. And watch to see how long I sit. Don't wait for me. Don't say, if you haven't been called in 30 minutes, come back up and let me know. No, I want to take responsibility and see that you haven't been called back in 15 minutes, actually, not 30. Again, and communication. Contact the back end. Who's arrived? Who's running late? Where are they in the process? You've still got somebody out here, so on and so forth. Make sure you have policies to support your workflow. Determine the when, your specific steps, who, the why. Why is the key. You've got to know why on everything. It's okay to ask why. When I do operations assessment, I always ask people, why do you do that? Why do you do that? People look at me like, oh gosh, I don't know, maybe that's wrong. It's not wrong. I just need to know why. And a lot of times what we hear is, well, we've always done it that way. Does that make it right? Does it make it efficient? Does it make it correct? So thinking about the why, you should ask. When your manager asks you to do something, it's okay to ask them why. You're not questioning what they're telling you to do. You're asking why so that you know why. If you know why you're doing what you're doing, you're going to do a much better job. Why do you need to collect money? Because if we don't, we're going to shut the health center down. Versus, well, collect money. I don't know why we're collecting it, but it just sounds like a really good idea. Create scripts, role play, create a financial policy. These are just some key elements that need to be part of that. Who are you contracted with? What are the time of service collections? Who's responsible? Referrals, collections, all of this should be part of your financial policy. Create a patient experience specialist. Patient calls in for their appointment. We do the intake. We talk about financial expectations with that patient. We're very transparent. We start looking at eligibility and verification of benefits in real time. We start looking at those standardized appointment types, making sure our schedule is efficient. We're not putting 3 new patients back to back. Why? Because if 3 new patients no show or show up late, we're going to have a mad clinical staff and it's not efficient. And if they don't come, we're not seeing any patients, which means we're not billing. When the patient arrives, real-time eligibility should occur automatically. So if we build the rules correctly, your EMR should do a lot of this. Again, we're having that transparent conversation with the patient about their financial responsibility. We're looking to see from our pre-visit planning, so I'm just verifying what happened from my pre-visit planning, what needs to be updated with this patient, if anything. Do I need to add anything in the EMR, or is everything perfect? Again, you are the first and last impression. How you handle any patient in any situation starts that patient's perception of your practice. You are often the only person from a billing aspect that has a face-to-face with that encounter. So if you think about that, if you forgot to collect my $5 or $10 today, how much money will we spend printing a statement, putting it in an envelope, putting a stamp on it, mailing it, trash, or comes back, and then we do this again. So now I'm in the hole on spending money to get $10 we could have got on the front end. Go above and beyond. Make sure you are fully present. When you are at work, you're at work. Come in, play your role. Remember something about that patient. Put stuff in your EMR. There's spots for notes. So when you're doing your pre-visit planning, if you know something about me, you might say, "Oh, Shelly, how are your kids? When's your son's wedding?" Just those little things. And then I beam up. I'm like, "Oh gosh, I feel so important. They know me. They know like something about me." In lieu of, "Thanks for coming. Sit down. Here's the forms. Fill this out." Then I feel like I'm just another number. Take a number and we'll call you when it's your turn. Communication. Listening. Silent, listen have the same letters. Many of us in our own world, we're always thinking about when someone's talking, what am I going to say? Oh God, I'm going to say something. I want to say something right now. And then I've completely toned out whatever you're talking about. Build the relationship. Offer ideas, opinions, but you're communicating, developing that relationship. And these should not only be for your patients, but just your internal customers as well, meaning providers, MAs, other staff members. Have compassion and empathy, right? Value others, show concern, and make sure it's genuine. If it's not genuine, don't bother. Think about positive language. Think about what you say before you say it. Sometimes we just like blurt stuff out, and I'm just as guilty as everybody else. And then I'm always like, oh gosh, that didn't sound very friendly. Sometimes even typing out an email. Sometimes if I'm really frustrated, I'll type it out, but I'm not going to put a to who it's to yet, because more than likely it's not a friendly email. So then go back later and read it. If you accidentally put the person's name in there, you might hit send and then it doesn't come across very well. Be aware. Cultivating a calming presence and a welcoming. When patients walk in, smile. Hi, nice to see you. How are you today? Oh my gosh, isn't that weather beautiful? Anything to make sure that it's calming and aware that they're walking in the door. Make sure you know how to read them. If you give a patient a form, and I'm doing this, means I might not be able to either A, understand it, or read it. So we don't want to say, well, Shelly, do you not know how to read? Or do you not know what that says? We want to say, I can explain that form to you. There's a lot of information on there. So that form is our financial policy. Mainly what it says is a blah, 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 a 30-second elevator speech. The next form behind that is our privacy policy. This just allows you to put down in that spot anybody's name that you would want us to give information about your health care. So if your husband or your daughter, or you can leave it with no one if you don't want anybody, and you just sign at the bottom. And that means we wouldn't give anybody information unless their name is on here. So making sure that you can read other people, because sometimes patients don't want to say, I can't read, or I don't know what any of this means. So just being aware. Ask yourself, is your attitude helping your patients and your team? Is your attitude helping you reach your goals? Is your attitude helping you be the person you want to be? And are you giving 110% effort? Every day, ask yourself this. It really starts to change your thought process. No, my attitude's not really helping me because I got caught up in some drama in the front desk of being not so friendly to the MAs, or I got caught up in the drama because the MAs are being a little bit snotty. So if you think about it, really taking that drama and changing your attitude so that we go above and beyond every day, all day long. So ask yourself and challenge yourself to do an ordinary job in an extraordinary way. Okay, so we've got about 4 or 5 minutes left for questions or just comments, things that you're doing in your health center that are working, or things that you're doing in your health center that aren't working. All right, so do we have any questions, or in the chat box, or you can just come off mute if you want and ask your question. You guys are really quiet.
Say there was a comment within the chat from Kelly, if you wanted to review that.
Okay, let's see. So it says a patient needs to know their insurance. It shouldn't only be the office staff to try to figure out what their copay or out of pocket is. We deal a lot with patients and they all have different insurance. They shouldn't be unhappy because we don't know their insurance inside and out. And I absolutely agree. And that is why also I would recommend like a patient advocate. So if you think about this, whoever we kind of challenge to be the patient advocate when we're calling new patients, and then once we get those taken care of, really start just kind of reaching out to our established patients, but to educate patients that when Shelly, you have Blue Cross Blue Shield. Blue Cross Blue Shield has several different plans. It is your responsibility as the patient to know what labs your insurance covers, why they cover them, what your copay and deductible are. We are going to expect payment when you come in. All of those things we should have that conversation with that patient. It is the patient's responsibility. I 100% agree with that. As you all know on this call, that's not always the case. But I'm totally fine when a patient goes, well, will that be covered? Well, I'm supposed to have lab today and they're asking you at the front desk, will that be covered? If you don't know, that's okay to say, Shelly, I'm not sure. Blue Cross has several different plans. I'm not sure about your plan, but on the back of your insurance card, you can just call them and they can give you that information, or you can look in your manual, etc. Other questions, comments, challenges? Just comments in general? Everybody's like, it's Friday. We don't really care about customer service today. We're ready to get out of here.
Not hearing or seeing any. We are just about at our time. So just want to remind everybody to click on the survey link that I have sent out. And then if you have any follow-up questions, please email me. I'll get them over to Shelly. And we're at the same time next week, 11 a.m. Mountain Standard Time, for part 3 and the final of the series. We look forward to seeing everybody next week.
You guys have a great weekend and enjoy, and hopefully you have good weather. And then we'll talk next Friday. Thanks, everybody.
Thank you. Bye.
Bye.